Shot could be recommended as early as this week for all Americans who got the Pfizer and the Moderna vaccines more than 8 months ago. So here to answer your questions is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Dr. T, it's always great to see you. Thank you for your time. ABC News did confirm today that the shots could be ready for distribution by mid-September. I know it's a simple question,
right?
But why do we need them so quickly?
Well, Ed, the virus is moving faster than we are, as we're seeing, and we also know that the vaccine, while still very effective at preventing severe illness, really has reduced effectiveness against infection. That's why we're seeing so many rising cases in the United States right now. The 7-day average is about 140,000, so that's significantly up. So I think that a booster is needed. Now, with that said, as you've heard me say before, most importantly is that the unvaccinated get their initial primary series. That's even more important.
Doctor, thank you for joining us. You received your Pfizer vaccine along with other healthcare workers last December. Correct me if I'm wrong. So, yes, correct? December?
You are right.
All right.
Yep.
So it's been more than 8 months for you. So are you concerned that you may have less protection right now than you originally thought?
So, Maria, you're right. There is less protection right now because of the Delta variant. We know that there's reduced effectiveness. That 95% effectiveness or efficacy that we heard in the clinical trials now is probably somewhere in that 40 to 50% range. But I'm less worried about myself and more worried about the half of the United States that remains unvaccinated.
So, and we do get a lot of emails, daily about everything. So we get emails today from viewers who did receive that single-dose vaccine from Johnson & Johnson. So will they need a booster too? And which one?
Right, so Ed, this is a little bit different because remember, we're waiting on the phase 3 trial of the J&J 2-dose vaccine series. So do I think ultimately that a certain percentage of the U.S., the elderly, immunocompromised people, perhaps everyone is going to need that second dose? I do, because I believe that more antibodies are better. But with that said, we have to wait for that data. So
when will that be? Do we know, Doctor? I'm sorry to interrupt.
I am really waiting for this. I feel like we should have it by now, but hopefully within the next few weeks.
All right, we'll keep an eye on that for sure. Veronica sent us this question. My mom, her immune system is compromised. She got the J&J at the end of April. Should she ask her doctor about getting another shot, or should she switch to Moderna or Pfizer? What's your advice for Veronica?
Yeah, Veronica and her mom, it's such an important question. I wish I had the answer right now. Let me tell you something. The CDC just recommended boosters for immunocompromised patients with the third mRNA vaccine and only those patients who received their first two. With the J&J vaccine, we still don't know. We're waiting for that data. We do need an answer. I will tell you that I feel like she does need a booster, and it's either going to be the messenger RNA or the J&J. I want to give it a little more time for J&J to give us the data and figure it out. But if there's no data from them, then I would recommend the mRNA vaccine. But we have to wait for the CDC to weigh in. Hopefully, they'll be weighing in soon.
We know you'll tell us.
Yeah, thanks for your time, Dr. T. Great to see you.
Thank you, Doctor.
See you
Be
later.
well.